Hello and welcome to the webinar, A Global Pandemic Ushers in a New Age of Telemedicine. I'm Ron Harmon King. I am CEO and founder of Vanguard Communications, and I'm coming to you from the beautiful Rocky Mountains of Colorado here in the United States on a late summer's day. You'll probably hear a few sounds of nature behind me, including perhaps a dog or two barking. So let's talk about telemedicine. I am one of two presenters today. I started Vanguard Communications 26 years ago, and in recent years, Dr. Neil Baum has joined us as Chief Medical Officer. He is the author of 10 books on medical practice management and marketing, as well as 250 plus peer-reviewed articles on urology. He is a urologist. He's on the adjunct faculty at the Tulane University School of Medicine. Today, we're going to talk about three things. I will start by pointing out some of the telemedicine trends in the world globally, as well as address some safe and effective telemedicine measures. And then Dr. Baum will address how IVF is a perfect fit in many ways for telehealth. First, though, let's look at how ubiquitous the internet is. And this is, of course, an underlying support for telemedicine. This is a map of the countries in the world with internet access. The darker blue countries have a higher percentage of residents with internet access. Lighter blue means a lower percentage. Interestingly, some of the smaller countries have incredibly high levels of internet access. Iceland and Bermuda, for example, both have more than 95% of their residents with internet access, followed closely, of course, by countries throughout Europe and North America. What this means, of course, then, after the pandemic became a matter of global concern, then more and more physicians and healthcare providers around the world felt they could better serve their patients remotely rather than having them come into clinics and risk further infection rates. So a Sermo survey found that in the United States, doctors saw a 67% decline in clinic patient visits due to the pandemic. This compares to a much lower rate worldwide, 15%. 85% of American physicians began treating patients remotely through the internet and telephone and so on. 47% of American physicians began using video conferencing after the pandemic began. So about half. This is a report from Sermo, which is a physician medical information website. And you'll see, if you go to that website, you'll see this report on there, which shows the rates of telemedicine for physician consultation and video conferencing, as well as other kinds of interesting data about the rise of remote access medical treatment. So, and you'll find here, and I want to point these figures out that were on that chart on the previous slide, they're kind of small, that roughly 63% of physicians in the U.S. are using telemedicine for initial patient consultations and follow-up consultations as well. This is followed not too far behind by 6 of the major European countries, the larger countries, as well as China and Japan and Asia. So telemedicine is definitely on the rise in this age of COVID-19. I want to point out here a study, an analysis that was done by Research to Guidance, a German-based consulting firm, did a very good job of analyzing which countries are most favorable to medicine. The U.S. leads the way according to their analysis, followed closely, of course, by Switzerland, Great Britain, and others. And you'll see that lots of this has to do with not only internet infrastructure, but also government and institutional support for telemedicine. I think it's not terribly arguable that the United States has been a pioneer in telemedicine, but I want to stress that more and more countries are taking up the cause as well. And I think this is very much a wave of the future that we all should be paying close attention to. Another interesting finding was reported by Health Advances blog, which grouped national readiness for telemedicine by country into three categories: established, developing, and initial. And you can read for yourself here which are in which categories. And there are some notable leaders in the established category, but also quite a few other countries that are closing the gap as well. In a similar vein, Bain & Company, the consulting company based in Massachusetts here in the United States, conducted a survey on the impact of COVID-19 on Asia-Pacific countries, and they found nearly half of the patients they surveyed expect to use digital health tools in the next 5 years. 91% of them said they would use them if costs were covered by an employer or an insurer. And most interestingly, since the outbreak of the pandemic in 2020, users of two online telemedicine services, Doctor Anywhere and MyDoc, rose dramatically in Asia-Pacific countries. Doc Anywhere saw a rise of 156%, where MyDoc saw a rise of 147% in just the first 2 months of 2020. So I think we can safely say that telemedicine is on the rise virtually everywhere in the world. I want to turn our attention now to both the components of safe and effective use of telemedicine. I'm going to be addressing a little bit of the safety issues. Dr. Neil Baum talking about effective telemedicine. Patient privacy is a major concern the world over, and it's especially more so during the internet age, and that's because safeguarding electric data has extra challenges that we didn't have in the days before the internet. Hackers love healthcare information. I've seen estimates of what the value is in the black market of one healthcare record range anywhere from less than $10 to as much as $100 per record. So this is why hackers love to take this information and resell it for healthy profits. They make a living from people being careless in the use of online healthcare data. And I want to point out that it's important in telemedicine because any communication involving the internet is vulnerable to hacking. And this includes telemedicine visits. We have to remember that these communications between a patient and a doctor, as much as they may feel private, they do pass through computer servers all over the globe. And each one of those servers is an opportunity for a hacker to gain access and steal the records. So it's a global concern. There are, of course, quite a few legal requirements, depending on where you live, around protecting this information electronically. And we have to be aware that there are quite a few jurisdictional complexities. There are different laws of the world over in different countries. Both national and international laws do regulate and oversee the protection of patient information, electronic information, and any patient information gathered by internet, social media, and even phone is generally protected under these laws. So let's review those quickly. And here are a few. And here in the United States, we have what's called HIPAA, the Health Insurance and Portability Protection Act, which has been in force since 1996. Europe has a similar set of standards and guidelines for protecting patient privacy under the Organization for Economic Cooperation and Development, the OECD, which has global signatories, so it has international participation, and that has been in force since the 1980s. And then more recently, Europe adapted what's called the General Data Protection Regulation, or GDRP, and that is applying to all members of the European Union. And in a similar way, Asia Pacific countries have adopted the Asian Pacific Economic Council recommendations, the APEC, on protecting patient privacy. Australia has the Australian Privacy Act. Russia has its own version, as does Japan. So virtually all the modern industrialized countries have stringent legal requirements on protecting patient privacy and especially electronic data that contains patient information. I do want to point out some key differences between the European regulations and those in the United States. Under HIPAA, we Americans are able to share at least some information with marketers that we gather from patients. This is, of course, a very American cultural inclination, I think. Whereas in Europe, the GDPR strictly prohibits that. The GDPR has two additional requirements, and that is any organization which holds information about anyone, whether a patient or not, whether it's healthcare or not, any information can be erased upon the request of that person. Electronically, those files have to be eliminated. And in addition, in healthcare, patients under GDPR must give their consent before the healthcare providers can store information electronically. That's mandatory. Two big differences that I think are reflective in many ways of our different cultures. It's important to be aware of the minimum online protection standards no matter where you are in the world. And that is, when you're conducting video or even audio consultations with patients in a remote location, you need to have those encrypted if it's going to transpire online. And in the same way, when you store any information gathered from those consultations, that needs to be encrypted too. And by encryption, I mean encryption both in storage and in transmission. So not everything you say over the internet through an app such as Skype or WhatsApp is encrypted. It is potentially accessible to hackers without encryption. On this slide, I present a few examples of both encrypted and non-encrypted software or platforms for use in telehealth. Among the encrypted choices are Doxy.me, Skype for Business, not ordinary Skype, but Skype for Business, UpDocs, VC, and so on. Not encrypted and generally less safe and protective of patient information is Facebook Live, ordinary Skype, FaceTime, and WhatsApp. These are permissible temporarily right now during the pandemic in the United States, but nowhere else, to my knowledge, would these be a good choice for long-term use in patient communications for telehealth. So a few basic guidelines to keep in mind to wrap up. Always use encrypted video and audio when communicating with patients for telehealth purposes. Do not store video or recordings of any kind on any kind of server or computer that is connected to the internet. That would give hackers a chance to go in and potentially hack it and take that patient information. And lastly, when you do store patient records electronically, which we should all do now in the digital age, choose a reputable electronic health record software system with double encryption. This means the data in patient records is stored both in transit and in storage, and in transit means it's being communicated across the internet. So for example, when you, the provider, or another provider looks at patient records, or when a patient has access to his own records across the internet, those records should be transmitted over the internet in an encrypted fashion. Similarly, they should be stored in an encryption, and that means it's much more difficult for a hacker to have access to it, and the data and patient records are therefore kept safe. I'm going to turn this over now to my colleague, Dr. Neil Baum, who will talk about how IVF is a good fit with telemedicine or telehealth.
Hello, my name is Dr. Neil Baum. I'm a physician in New Orleans, Louisiana, and I would like to thank you for the opportunity of addressing this IVF Worldwide Conference. Hopefully, this virtual visit will be a substitute to being there in person. And hopefully next year we can all be together. A few numbers that you need to know. Global healthcare spending is $7.8 trillion. Now just think about this. The American spending in healthcare is over $3 trillion. We spend more than 50% of all global spending is spent within the United States. That number is estimated to go over $10 trillion by the year 2025. 2022. That's not very far away. And it is predicted that the spending in the United States on healthcare will exceed the gross domestic product, will be in excess of 20%. And yet, telemedicine occupies only 1/2 of 1% of healthcare spending. What does that message mean? That message means that we can use telemedicine as an opportunity to increase our communication, with our REI patients. This is an example of a huge market that is available in healthcare today by embracing telemedicine and making it part and parcel of every REI practice. The benefits of telemedicine in REI practices is that it provides a communication convenience for our patients. They like to be able to communicate with their doctors using virtual visit. Also, telemedicine gives us an opportunity to communicate with providers at a great distance from our bricks and mortar facility. Finally, telemedicine offers us to enhance and improve our patient satisfaction, which ultimately comes down to our online reputation. As physicians, we spend our entire life protecting our online reputation. We can enhance that online reputation by embracing telemedicine in our practices. So, what are some applications for using telemedicine in an REI practice? We can conduct new patient consultations before we ever touch a patient, can be conducted online effectively and safely, and provide a great deal of information on what we can do for infertility patients. We can allow those new patients and existing patients to meet our care team in our practice. We can use telemedicine to review test results, and also we can use it to have follow-up examinations with our patients. And this can be very useful to patients, and it enhances our ability to connect with patients without having to physically touch our patients or to be in the same room as our patients. We can use telemedicine to discuss the treatment plan with our patients. We can also use telemedicine for allowing our patients to discuss the financial arrangements and what will be the cost of their care during a telemedicine visit. Also, many patients and their partners have questions following their visit with the doctor, their face-to-face visit with the doctor. The telemedicine allows us to answer those questions. Finally, you can use telemedicine to schedule virtual seminars with your patients and meet with multiple patients at one time. Certainly, if you're going to use telemedicine, regardless of what country you are practicing in, I think it is imperative that you obtain a consent, ideally a signed written consent that gives the patient permission for you to communicate with them using telemedicine and make that part of their permanent record. I think it's important that we have a certain etiquette involved regarding telemedicine. Certainly, you want to have a environment that is well lit without any reflections and not have a distracting setting. I've seen many telemedicine visits that occur in a doctor's office or in the doctor's home, and there are a bookcase behind the doctor. And patients are probably looking at what are the titles of the books rather than focusing on the doctor. You want to let the patient know and ensure privacy. I think you have to dress like a professional, and that means looking like a doctor, which easily is accomplished by putting on a lab coat. I'd like to emphasize how important it is, if you're doing a telemedicine visit, that the doctor be on time. Patients are not going to wait 15 and 30 minutes like they often do in our reception area or the exam room. Next, make every effort to review the patient's chart before the telemedicine visit. That is not a time that your head should be down looking at the chart, but it should be looking at the webcam or the camera and not focused on other papers or the electronic medical record. Finally, it is important that the telemedicine visit be concluded and asking the patient have all of their questions been answered during the telemedicine visit. Next, I want to recommend to you that you have a Tele-Huddle every day with your staff. This could be a 2-minute visit with your staff, and it just might be the best 2 minutes that you interact with your staff each day. The benefits of a Tele-Huddle is you discuss the day's schedule. Everybody is on the same page. You look to identify any potential problems. You notify the staff if there are going to be delays because of procedures that you're going to be doing in the office. It also enhances the efficiency and significantly increases the morale of the staff, knowing that everybody is functioning as a team. By having a Tele-Huddle, you can decrease burnout, which is impacting over 50% of most medical practices. And also, if you have a Tele-Huddle, you can be sure that everybody is on the same page and you will be reducing medical errors. My take-home message is that telemedicine is an effective and safe way of communicating with patients without the necessity of having to touch the patient. It is a way of creating enhanced communication and empathy with your patients.
And that concludes our presentation. Thank you for listening.